Many men over 50 quietly notice small changes in their health but brush them off as just aging. Maybe you wake up more often at night to urinate, feel tired even after a good night's sleep, or experience discomfort you cannot explain. These moments may seem minor, but they can sometimes signal something deeper. Prostate cancer often grows silently, and by the time symptoms become obvious, it may already be harder to manage. That is why recognizing early signs matters so much. The challenge is that most seniors ignore them, thinking they are not serious. In this video, we are going to count down 7 early prostate cancer signs that men over 50 often overlook. Each one is explained in simple, clear language, so you can notice the warning signals in time. Number 4 could truly save your life if you pay attention today. Where are you watching from today? What health issue are you currently facing? These are safe conversations to share, and you might even help someone else. Before we dive in, we've also uploaded some helpful prostate-related material inside a free senior health app, including trackers and simple guides. The link is in the description and pinned comment if you'd like to check it out. 7. Frequent nighttime urination. Waking up once in the night is common, but when it happens 2, 3, or even more times, it may be a sign your prostate is pressing on your bladder. Seniors often assume this is only because of aging, drinking water too late, or simply weak sleep. But frequent nighttime urination, called nocturia, is one of the first signs your prostate may not be functioning normally. It happens because the enlarged prostate squeezes the urethra, making it harder for urine to pass, so your bladder never fully empties. Over time, this creates irritation and the constant feeling of needing to go again. For many men, this is ignored until it becomes disruptive, leaving them exhausted during the day. You may notice yourself planning trips around bathrooms or avoiding long walks out of fear. That loss of freedom can be very discouraging, but the truth is that noticing this early can save you years of struggle. Keeping a simple bladder diary, limiting evening caffeine, and gently strengthening your pelvic muscles may bring relief. More importantly, it tells you it is time to talk to your doctor and rule out prostate issues before they grow more serious. Early awareness protects both health and independence. 6. Weak or interrupted urine flow. Another early sign many seniors overlook is a weak urine stream. You may notice that starting to urinate takes longer, or the flow stops and starts instead of being steady. This happens because the prostate, when enlarged or affected by abnormal growth, presses against the urethra and narrows the passage. The bladder then strains harder to push urine through, which is why you feel incomplete relief. Many men laugh it off or say, "I guess I'm just getting older." But the truth is, this is not just about aging. It can be a red flag for your prostate. A weak stream also increases the risk of urinary infections because bacteria grow in leftover urine. Imagine how discouraging it feels to stand there waiting, only to leave unsatisfied and frustrated. The body is speaking loudly in these moments, but many ignore the message. A simple daily awareness check can make a big difference. Notice if you need to push harder, if the flow is slower than before, or if it suddenly stops midway. These changes are not normal. Natural habits like drinking enough water earlier in the day, limiting alcohol, and doing gentle pelvic floor exercises may support bladder function, but do not replace medical attention. Ignoring this warning could delay life-saving care. 5. Blood in urine or semen. Seeing blood, even a small streak, in urine or semen is one of the most alarming yet often ignored signs. Some men convince themselves it must be from straining, exercise, or even food. But blood in either urine or semen is not normal and never something to dismiss. It can appear pink, rusty, or bright red depending on the amount and should always be checked. The prostate is closely linked with both urinary and reproductive systems, so when cancer cells or abnormal growth irritate delicate tissues, bleeding may occur. Seniors sometimes wait, hoping it will go away, but that delay can cost valuable time. It is not always cancer. It may be infection, kidney stones, or another condition. But ignoring it is never safe. Imagine the peace of mind that comes from knowing early rather than worrying silently for months. If this happens once, you may want to observe, but if it repeats, even lightly, you must see your doctor immediately. Staying hydrated, avoiding unnecessary strain, and keeping track of any changes are natural ways to support your health. But remember, this is one sign that can never be explained away safely. Quick attention here could make all the difference. 4. Unexplained pain in lower back, hips, or thighs. Pain is often blamed on arthritis, aging bones, or an old injury. But prostate cancer sometimes spreads silently to nearby bones, especially the spine, hips, or thighs, before being noticed. This can show up as dull aches, stiffness, or pressure that does not improve with rest or normal remedies. Many seniors dismiss it, saying, "It's just old age." But if pain appears suddenly, grows worse at night, or feels deep inside rather than muscular, it could be a warning sign. What makes this tricky is that the pain feels so ordinary that men ignore it, yet catching it here can truly save your life. Once prostate cancer spreads to bones, it becomes harder to treat, so listening to your body now is critical. Seniors can gently manage everyday aches with light stretching, warm compresses, and staying active, but unexplained persistent pain always deserves attention. Keeping a simple daily log of where and when pain happens helps spot patterns. If you notice pain along with urinary changes, it is even more important to see your doctor. Your body is not just aging, it may be asking for help. Listening to this sign at number 4 can mean the difference between control and crisis. If you're facing urinary pain, frequent bathroom trips, or unexplained discomfort, and you're over 60, this may be your warning sign. Thousands of seniors are already using a free health app that gives them simple tools to track symptoms, avoid risky foods, and feel supported every day. You'll find the link in the description and pinned comment. Don't miss it before it's too late. 3. Difficulty controlling urination. For many seniors, leaking urine when coughing, sneezing, or laughing is an embarrassing subject. But when it happens frequently, or you cannot hold urine long enough to reach the bathroom, it may be a sign of prostate issues. This happens because the prostate and bladder work closely together, and when the prostate is affected, it weakens bladder control. Men often suffer in silence, using pads or avoiding outings, but this greatly impacts quality of life. Imagine the stress of planning every trip around bathroom access. Many brush it off as part of getting older, yet prostate cancer can quietly cause this by pressing against the urinary system. Seniors can strengthen bladder control naturally with pelvic floor exercises, limiting late evening fluids, and practicing scheduled bathroom visits. But ignoring sudden changes in control is risky. It not only affects independence, but can also be an early red flag. Talking openly with your doctor about leaks or urgency is important, even if it feels uncomfortable. Sharing honestly can lead to early checks that might save your health. Remember, control is not only about dignity, but also about safety. Acting early gives you a chance to keep both intact. 2. Erectile difficulties. Many men after 50 face changes in sexual health, often blaming stress, age, or fatigue. But when difficulties with erections suddenly appear or worsen, it can sometimes be linked to prostate cancer. This happens because cancer growth or an enlarged prostate affects blood flow and nerve signals in the area. While erectile dysfunction can have many causes like diabetes, heart problems, or even certain medicines, ignoring it when combined with urinary symptoms is dangerous. Seniors may quietly avoid intimacy, feeling embarrassed or guilty, but it is not something to hide. Noticing changes early gives you more options. Gentle lifestyle habits such as walking daily, reducing alcohol, and eating more heart-healthy foods can improve circulation. But if this problem comes suddenly, it deserves medical attention. Men often forget that sexual health is closely tied to overall health, and changes here can signal deeper issues. Talking openly with a partner and doctor brings relief and sometimes saves lives. Remember, protecting prostate health also protects intimacy, confidence, and emotional connection. Do not ignore this sign. It could be more important than you think. 1. Unexplained weight loss and fatigue. When the body fights hidden illness, it burns energy faster than usual. Seniors may notice they lose weight without trying or feel tired all day despite sleeping well. This is often brushed off as stress, diet, or simply getting older. But unexplained weight loss and persistent fatigue can signal that cancer cells are using energy and placing strain on the body. In prostate cancer, this often shows up late, but it can also appear earlier than most realize. Imagine losing pounds while eating the same meals or feeling drained after light activity. Many men accept this as normal aging, but it is not. Natural energy support like balanced meals, gentle exercise, and staying hydrated can help. But if the change is sudden and ongoing, it must not be ignored. Seniors sometimes wait too long before mentioning it to their doctor, losing valuable time. Fatigue and weight loss may also connect with other signs like urinary issues or pain, making them even more important. Your body always communicates, and these are serious signals. Paying attention here not only protects health, but may also give you years of added strength and independence. Today, we counted down 7 early prostate cancer signs that men over 50 often ignore. From nighttime urination to pain in the hips or sudden weight loss, these warnings may feel small, but they can change everything if noticed early. Many seniors believe these changes are simply part of aging, yet your body often whispers before it shouts. Listening to those whispers is the key to protecting your health. The good news is that early awareness gives you choices, and choices give you control. Even gentle daily steps like tracking your health, eating wisely, and staying active help build confidence and strength. To avoid missing warning signs and to stay on a healthy routine, check the link in the description and pinned comment for the free Senior Health app. It's helping thousands of seniors feel more supported every single day. Always remember, consult your doctor before making changes and never feel embarrassed to ask questions. With awareness and small steps, you can protect your prostate, keep your independence, and move forward with hope and strength.